Medicare and Medicaid, been around since 1966, and a lot of changes are on their way for these two programs. I'm here now with Lynn Shapiro Snyder, a senior member of Epstein Becker Green law firm. And you've been talking with people about these programs for over 30 years, giving strategic advice on these programs. What do you think the future holds for them?
Well, a lot of people don't know that Medicare and Medicaid were actually enacted the same day as a political compromise between those who wanted to help the states with their uninsured or underinsured people and those who felt that the elderly people needed access to health benefits since we had a very difficult individual insurance market. So now we're actually 45 years or 46 years later, and the baby boomers are just about to hit Medicare, and we're about to increase the number of Medicaid people as part of health reform. And these entitlement programs play a significant role in our budget, and we're just not prepared. So the last 5 years, we've added about 500,000 new Medicare people, but this year that number goes to 1.3 million. So there's almost a 3 times increase in the new 65-year-olds. Right. And we are putting them in a Medicare program that's under tremendous change. There is the fee-for-service original Medicare, and then there's Medicare Advantage where the government outsources everything to an insurance company. And then there's reform, which is what I call the hybrid Medicare program, which they're just starting to implement now, whether it's an accountable care organization, a bundled payment, a demonstration project. And I think that unfortunately some of these changes needed to be in place sooner, quicker, but at least they're going in a direction to try and minimize the rising costs of health care.
Is that going to be successful, Lynn?
It depends. It takes 2 to tango. So the government has to do a great job in implementing these laws. But if nobody comes to the tea party to enjoy the food and drink, then we could have these great laws sitting on the books, but nobody taking advantage of it. So what I've been advising providers and payers is first and foremost to look at your local community, because healthcare is local. Look at who your private payers are, and are there ways that providers and payers can collaborate rather than be confrontational to be able to address quality and efficiencies, and then come to CMS, because there are ways to customize now your Medicare payments, which we've never had that flexibility before.
And might we see more specialized program? You mentioned the Advantage program, for instance. Might we see different grades of Medicare or Medicaid?
Yes, and I think you're going to see, especially for those who are dual eligible, there's going to be a whole new set of opportunities. Those are people who are both Medicare and Medicaid eligible, where the Medicare program has opened up a special office for dual eligibles. And again, the opportunity for both payers and providers to go to CMS and customize the way they want to interact with these federal programs in order to encourage innovation, cost containment, and good quality. So I think CMS has a lot on its plate, but I think the healthcare industry needs to also take a look at not the status quo, which is either the regular Medicare program or the regular Medicaid program, but really think outside the box and see what type of Medicare and Medicaid program do they want in the future, and is there a way that they can help shape it. And one of the best ways they can do that is by reviewing what's coming out of CMS now, commenting on what's in these proposed regs, and continuing to play a role in healthcare reform.
What else are you encouraged by? What other good news can we glean from all of the changes that are on the horizon?
Well, I think the opportunity for technology and some of the IT infrastructure that's already underway bodes well. 20 plus years ago, when people tried to do capitation payments to a provider group, it was much harder to have electronic information and data collection. And I think that with some of the new products that are on the market and the ability to track expenditure data quicker and faster, also some of the remote monitoring devices that help patients be able to access health care without even visiting a doctor's office or without going into the hospital bodes well. But in order to have this innovation, you need payers and you need providers who can afford to purchase them. And right now we have the greatest amount of cost pressure on the payers from health reform, and we have the greatest amount of cost pressures on providers because of health reform. So it'll be interesting to see who are the survivors and who's going to be able to be quicker, faster, and better at what they do, because there's just going to be less resources for them to be able to do it with.
Okay. Lynn, thanks so much for your time today.
Thank you.
I'm Mabel Zhang with the World Healthcare Congress in Washington, D.C.